Good evening, thank you for joining me. This is Eric J, and tonight we'll be discussing a comparison between universal or single-payer healthcare and an alternative that almost no one really acknowledges or seems to know about called direct primary care. Don't forget, make sure you hit that subscribe button so you don't miss out whenever I upload a new video. Also, for those fans of Ron Paul, go ahead and look below at the description box for his link for his homeschool curriculum. Now, as I said, we will be discussing universal health care, also known as single-payer care. And it is majorly in discussion, usually amongst more liberally minded people, to think that it would be better and it's cheaper to go with the single-payer, which is basically essentially just government subsidized health care. One thing to remember is that publicly subsidized healthcare is healthcare with money taken from not only you, but all of your neighbors. So essentially, the government is taxing your neighbors, taking money from them, so there's no voluntary consent, regardless of what they say, that they want to help you out, so therefore voluntarily paying your taxes. But it's kind of a contradiction in terms of voluntary paying taxes, because if you don't pay for the taxes anyways, government will take them by force regardless. So just remember, it is taken, not given. Now if you think about it, this is actually referencing one of the core tenets of the Communist Manifesto, meaning from each according to their ability to each according to their need. Now, like I said, I know that there is a general desire to help those in need, and so people seem to think that the government option is the best option with regards to healthcare. Now, let's address the concern right now. What we've had until this point has not been true free market healthcare, because there's a lot of crony capitalism involved. A lot of backside government subsidies that are brought into the healthcare markets, a lot of restrictions on healthcare markets, a lot of protections of certain industries so that they can increase their own costs at the expense of any kind of competition, because there really is no competition to balance out the price scale. Now, just to address this, universal healthcare or publicly subsidized healthcare is still subject to the mandates of the free market, meaning that although you have a nurse or a doctor who's providing you care, they're still subject to certain support industries, certain support services, who still provide goods and services to them, so to enable them to be able to provide these services to you. And the goods and services, the prices of those services don't go down simply because there's market restriction or market subsidies placed on this. What actually it is, all of these public subsidies are a mask for the real prices involved. So these prices have no real competition being introduced into it to allow them to compete one way or the other to lower those prices and increase the quality, because due to government subsidies being injected into the market, they're paying the vast majority of those cost of those prices for the additional balance of that. And what that is doing is that you're effectively being double taxed, because you're being taxed the first time in order to pay for the subsidy, and then you're being effectively taxed another time by paying for however much it is in order to pay for the service. And there's no actual market competition there. It's just whatever the government involves itself into to supposedly make it cheaper for you. Now, even if the government subsidizes it 100%, the cost for those subsidies, the taxes for those subsidies, still has to come from somewhere, which is going to result in blanket tax increases across the entire population. Now, some people might say, well, I have no problem with my taxes going up if I'm helping to pay for somebody else. Well, that's good for you. However, you're still being forced to pay that, and your next door neighbor might not feel the same way. So he or she is being mandated to pay for a service that he or she doesn't want. So there's no voluntarism involved. There's no voluntary transaction. And if you feel so compelled to pay for the service for somebody else, well, just donate money off to a charity who will pay for it. Write a check. Give money yourself. Find a charity that is willing to pay for the health care of the people who are in need. Don't rely on the government to cover those costs for them through taxation. One thing also to consider is that since public subsidies are not market driven, they are not, you might have a central planner who tries to dictate what is needed here, what is needed there. but as anybody who's gone through any kind of medical service realizes, those needs of the individual consumer are highly variant to their own medical needs. They're highly specific. And one central planner, or even 100 or even 1,000 central planners, even if they get together, it's not literally possible for them to determine all of the potential needs for a population of millions, of hundreds of millions. So you really need to have a market that can adjust to the ever-changing, highly variant circumstances for the individual cases per each consumer, per each patient. And if you also consider this in a publicly subsidized environment, since the government is paying for it, all of the medical decisions, or at least the vast majority of them, are being made between the government and the doctor, not you as the patient. Now they may say that it is patient driven, but really it is the government will pay for what the government decides to pay for. And as the saying goes, whoever has the gold makes the rules. So if the government tells the doctor, no, we're not going to cover that, and then you have made yourself reliant upon the government to cover your medical need, and yet they simply decide for whatever reason, no, we're not going to cover that medical need, well, then you're on the hook to cover the costs for those medical services that the market was not able to negotiate down on the price. So it's a much higher cost than necessarily would be otherwise. Now, related to this, actually highly involved with this, is a situation that I addressed in another video about the high price of drugs. Now, in that situation, the high price of drugs is actually related to government protection of several drug manufacturers who made it through their testing process, and it's actually FDA protected. But like I said, it's in the video below. Go ahead and check that out. Now, one thing to consider is that the Senate's created a law which requires all hospitals to show price transparency. Now, a lot of people might think, well, awesome, now we can actually see what's actually involved with these prices. However, it wasn't actually necessary for the Senate to do this because the free market was already doing this. So it's an unnecessary additional bit of legislation being injected into the marketplace that's already being perpetuated. Now, for example, this price transparency is already being practiced by a firm called the Surgery Center of Oklahoma. The link down below. This surgery center has a website which will show you exactly as much as you're going to pay, no more, no less. A lot of the times, yes, they'll accept insurance, but they'll also have it to where the consumer can directly see exactly what they're paying for, so there's not a whole lot of need just to rely on insurance. Now, think about it this way also. If you are in charge of your medical needs, if you say you go off to a good example is a grocery store. You pay for only exactly what you want to pay for, not more than what you want to pay for. Now, why do I bring that up? Because there's a lot of times, and some people who've been through hospitals can attest to this, that sometimes a specialist will walk by your room, check out your chart, read through it, and then put it back down and then bill you for it because now they've injected themselves into your medical decisions, even though they have literally nothing to do with what you're there for. And I would challenge anybody to take a look at their past bills or be aware as to how the medical staff is working the next time you're at the hospital to make sure that people don't unnecessarily bill you for that. It's something to be highly aware of, and it's an unnecessary extra expense. Now, most of the time, most insurance companies, most private insurance companies, they just pay off a bill regardless. Now, they might negotiate it around a little bit, but for the most part, they just kind of charge down they just pay for the bill. And so if they are not actively looking to itemize every single bill because there's just so many patients that they're dealing with, how much more are they paying for? And because they're paying for even more, how much more are they increasing your premiums as a result of that increased higher cost they're having to pay for, since they're not nickel and diming itemizing every single bit on that medical bill? It's something for you to think about. But first, below is a link to the Tom Woods Liberty Classroom, where you could really learn a lot more about free market economics, which is the same school of economic thought which Murray Rothbard and Milton Friedman really championed. Like I said, there's another option called direct primary care. Now, what is direct primary care? First of all, you can actually Google this. I'll write it down there at the bottom so you can see. But what it is that is a healthcare model which allows for essentially no interaction between the doctor and the insurance, but it's strictly between the doctor and the patient. Now, there might be some situations where the doctor will accept insurance, but largely it's just an interaction between the doctor and the patient. And how does this help? It helps because it makes you the primary consumer, it puts you in the driver's seat. It makes you completely free in your medical decisions because the doctor is now working directly for you. You are in charge. You are the boss, not the government, not some insurance company who will only pay for whatever medical practices you want and under whatever timing. No, they work directly for you, and I would highly recommend everybody search out your closest direct primary care provider. I don't know how far away from you that they are, but I recommend searching them out. Now, there's a documentary made by a man named Colin Gunn, which I'll actually link below, called Wait Till It's Free. And it actually goes into the entire situation as I was discussing, which actually compares what we have to the Britain's NHS or National Health Service, referencing also a documentary by Michael Moore, which you can actually watch in there, but it shows you several providers, or at least one, who pursue the direct primary care model. They can charge what they want or not. They can accept barter, whatever the situation happens to be. It is entirely a voluntary agreement between you and the doctor, as it should be. In some cases, I've even heard of doctors who are still willing to make house calls like the old country doctors do. So that level of true intimacy between the patient and the doctor is something that I think most of us would truly appreciate and want. Someone who actually knows our genuine needs and doesn't have to deal with all of the government restrictions related to Medicare and related to accepting Medicare billing, but just accepts you for who you are, accepts the payment that you're willing to give them, and does so in a mutually beneficial, cooperative situation. What you're about to see now is about a 2.5-minute trailer for Wait Till It's Free.
In a few moments, when I sign this bill, health insurance reform becomes law in the United States of America.
The left in America has been trying for 50 years to get control of the healthcare system.
Moving towards a single-payer system could very well make sense.
I'm all for a single-payer system.
I wanted single payer.
Instead of having a single payer or a national health service style plan, it often ends up being crony capitalism.
I said, I don't know, $7,000, $8,000, and she said, no, it's $20,000.
The buyer doesn't know what the prices are and can't do anything about the prices even if he knows what the prices are.
The American system is barely capitalistic at all because there's so much distortion to the system by how involved the government already is in the whole process.
For some person to stick his Pinocchio nose between me and my patient, that person is an interloper.
The market is just begging and pleading to help out, and yet all we get from Washington is obstructionism.
When government comes up with a bad idea, there's no way to get rid of it. They don't solve the problems. Capitalism solves problems.
The long-run solution to the U.S. fiscal problem is death panels and sales taxes.
To say that there is no death panel may be naive, but I think worse than that, it's deceptive.
The people who will suffer most when the government gains control, the children or the old people, these are the ones whose care will be rationed.
Thank you, Planned Parenthood. God bless you.
If the government can tell you that you have no religion in your business, if they can take away your faith, they can take away a lot of things.
Military veterans are dying needlessly because of long waits at some U.S. veterans hospitals.
And if they died, they were just crossed off as if they'd never shown up for care.
So tell me, what do you think of the National Health Service?
Rubbish.
The British have been subject to a confidence trick that their system is the best, when actually it's either the worst or amongst the worst in the Western world.
Elderly and vulnerable patients were left unwashed, unfed, and without fluids.
Governments are not very good at running things. Why should we expect them to be any better at running hospitals? Don't imagine that if you go down this road, you're going to be able to change your mind later.
We can say right now that the key issue is we do not want socialized medicine.
Thank you for joining me tonight. Make sure you remember to subscribe, like the video, and comment.